Good evening, everyone, and welcome to tonight's webinar, part two on common goat diseases in Victoria. I'm Dominic, I'll be your host tonight. Welcome to any newcomers and welcome back anyone who joined last week. A little bit about the Stock Sense project. Stock Sense is a project that's run by the VFF and we're funded by the Cattle Compensation Fund and also the Sheep and Goat Compensation Fund and proudly delivered by the VFF Livestock Group. And Stock Sense was established to help Victorian livestock producers maintain and improve animal health and welfare, as well as Victoria's overall biosecurity status. We do this through workshops, webinars, we have a number of fact sheets on our website, and we also have a quarterly e-newsletter. These are some of our upcoming events in September and October. Hopefully there's one near you. So we have events in Karlsruhe, South Gippsland, the Yarra Valley, Bor and Ballerine. If you are interested in attending any of those, please head to our website. Tonight, we're lucky enough to welcome back Dr. Berwyn Squire. She'll be talking on common goat diseases. Since 2005, Berwyn has worked for the Victorian government as a vet in Northwest Victoria. In 2009, she was fortunate to start a role assisting Victorian goat producers with their disease, welfare, and legislative issues. Outside of work, Berwyn has her own boar goat herd, which keeps her busy on the weekends. A little bit of housekeeping before we get into it. There is a Q&A box down the bottom. If you do have questions, please type those in and we'll answer those after the presentation. The presentation will be roughly 1 hour, followed by up to 30 minutes for questions. And we will send some slides out in an email along with a recording to this webinar. There will be a link to a survey as well, so we appreciate any feedback. And if you'd like to subscribe or visit our YouTube page, you have access to a number of past webinars, and there's a fair bit of goat content on there as well as some sheep and cattle content too. This is how you can stay in touch. If you'd like to send us an email, there's our email address, and also the VFF website is where you can access our resources and upcoming events, vff.org.au/stocksense. So Berwyn, I'll stop sharing there. We've been lucky enough to have Berwyn talk at a few webinars now, so welcome back, and just had a sneak peek of the presentation. It's very in-depth, so I think it'll be very worthwhile. Over to you. Thank you.
Okay, thank you, Dominic, for inviting me back to talk. What I might do, I might just turn this, hide myself view so I don't look at myself talking. Okay, I'm Berwyn Squire. I'm the Goat Health Veterinary Officer for Victoria, for Agriculture Victoria. Now, I'm going to be talking about managing some of Victoria's most common goat diseases. There is a warning, though, that some of these photos can be distressing to some people. So within Agriculture Victoria's Animal Health and Welfare Unit, Victoria is divided into 3 regions, the northern, the southwest and the southeast. These regions are further subdivided into districts that either have 1 or 2 veterinary officers and 1 or 2 animal health officers, depending on the size of the district, the number and density of the animal industries, and number of shires within that district. Across the whole state, for after hours and on the weekend, we have a duty officer, 2 veterinary officers and 2 animal health officers located throughout the state on standby for any emergency animal disease. So the knowledge of the numbers and the location of where livestock are really depends on you, the producer, applying for a property identification code and updating your contact details, land parcels and your livestock numbers, either via a paper-based application form, or we do actually have an online portal available on Agriculture Victoria's website. Today, I checked the numbers and we currently have 4,245 active PICs that have indicated they've got goats. And for those that have put in the number of goats they've had, there is supposedly 84,650 goats currently in Victoria, with herd numbers ranging up to over 8,000 head. We have 113 herds that have got 100 or more goats. 27 of these have more than 500 and 16 have got more than 1,000 head. The number of properties with goats could be double this, as not many producers have indicated or updated what stock they have, and then there are many properties out there are yet to obtain a property identification code, despite these currently being free in Victoria. So with laboratory diseases, the department receives some of the results from submissions that you submit via your private vet, and these are entered on a disease management system, and they include significant disease investigations that are conducted by our staff, and positive notifiable disease results. This system is known as YES, and for the past 5 years, this is what this photo indicates over the last 5 years, 320 disease investigations were undertaken on 85 properties in goats, with 56 of these investigations being approved as significant disease investigations and conducted by private veterinarians. So disease investigations, the top 10 clinical signs of why producers called their vets in included abortions, anemia, arthritis, dehydration, listlessness or lethargy, diarrhea, emaciation or weight loss, being found dead with no other clinical signs, lameness, pyrexia as in fever, and being down, recumbent and not being able to get up. Diarrhea was seen in 43% of these cases. Weight loss was in 22%, and listlessness, lethargy was in 15%. If a necropsy or a postmortem was conducted by the vet, the predominant signs were of lymphadenopathy, which is enlargement of the lymph nodes, pneumonia, emaciation, which is skinniness and weight loss, abomasitis, which is inflammation of the abomasum, which is the fourth compartment of the stomach, granulomatous enteritis, which is just a way to describe a type of inflammation within the small intestine, and pulmonary abscesses. The top 10 diseases that were tested for were salmonellosis, yersiniosis, internal parasites, either worms or coccidia, caprine arthritis encephalitis, paratuberculosis, otherwise known as Johne's disease, Campylobacter infection, enterotoxemia, transmissible spongiform encephalopathies, which is TSE, scrapie, listeriosis, and hypocalcemia. Yet while those diseases were the ones that were tested for, the top 10 diseases diagnosed were internal parasites, CAE, yersiniosis, Johne's disease, Campylobacter infection, salmonellosis, foot rot, listeriosis, plant toxicities, and nutritional deficiencies. In 20% of these cases, internal parasites was a contributing, if not the main cause of the disease presentation. Notifiable diseases that were excluded over the past 5 years included anthrax, Brucella melitensis, foot and mouth disease, vesicular stomatitis, lead toxicity, and TSEs. Now, whilst producers can get a subsidy for cattle and sheep brains tested for TSEs, goat producers do not yet. But as the lab tests are mostly covered in a TSE exclusion, it is a good option to determine whether the neurological signs seen in the goats are due to enterotoxemia, listeriosis, polioencephalomalacia, or another disease. So Victoria is fortunate to be free of most of the serious diseases that affect animals in other parts of the world. The SDI program aims to boost Victoria's capacity for the early detection of such diseases in livestock and wildlife by increasing the participation of vets and subsidising the cost of investigating significant diseases. So subsidies are available for the initial field investigation, including clinical and necropsy evaluation, lab testing, and if follow-up investigation needs to occur with significant disease events. And I know I recently mentioned about listeriosis. We had an issue with listeriosis being diagnosed on 4 to 5 different farms within the state, not connected with each other, and all of those were investigated under the Significant Disease Investigation or the TSE program. So what is a significant disease? It's an unusual or atypical manifestation of disease. It could be high morbidity, mortality, or spreads rapidly. It can be an issue when you've called the vet out and the first lot of samples they've sent away has failed to establish a diagnosis, or when it hasn't responded to the veterinary treatment that's been given. Or it might have an effect on trade, public health, or there is a genuine suspicion of an emergency animal disease. I hope all of you have got the emergency animal disease hotline number in your phone, because if you see anything unusual or suspect an exotic or emergency animal disease, immediately contact us or ring that number. Now, what are notifiable diseases? These are diseases that have been determined nationally and statewide that when they are suspected by owners, vets or laboratories, they must be reported within a defined time frame. Ways in which producers and their vets can notify are either by the EAD hotline number, the email, or there is a Notify Now app available. There are several notifiable diseases that are present in Victoria that can affect goats, and these include CAE, lead poisoning, leptospirosis, listeriosis, Johne's disease, and salmonellosis. The thing to consider, other diseases that we record are zoonotic diseases, and the main ones that I tend to hear from goat producers that are affecting their livestock and may affect them themselves are contagious ecthema, which another name is scabby mouth or sore mouth or ORF, Q fever. In livestock, it's called Coxiella burnetii. In Australia, we are very fortunate there to have a vaccination for Q fever. And I find that farming groups and certain districts tend to try and subsidise the testing and the cost of the vaccine for their members. Ringworm is another one, salmonella and toxoplasmosis. Now, we also have another database linked to the PICS for non-clinical disease data. And in the past 5 years, this map shows where all those testings occurred. And there were 844 non-clinical disease surveillance investigations on 282 properties. Now, despite the animals not exhibiting any disease issues, this is just routine surveillance. There were 37 properties on which CAE was detected, 16 properties had internal parasite issues, and 47 properties within that 5-year period had JD blood reactors. And these were either false positives, true positives, or Guedere vaccine reactions. So for national goat health assurance programs, in Victoria, we currently have 4 herds enrolled in the biosecurity, CAE, and JD goat maps. If you do annually test your goats for CAE and or JD, you might consider these modules as you no longer need an approved APAV vet and can use your local vet for this program. And over time, once you've got a history of negative testing and everything, the actual testing requirements are reduced. So how do disease issues actually enter a property? Unfortunately, normally you buy it in. You bring it onto the property by either purchased livestock returning from shows, agistment, drive-by matings. It can be brought in with feed, purchased from properties that co-graze livestock. You've got your weed seeds, your chemical residues, your protein, energy, and mineral imbalances. Can be come in from the neighbour via water or wind, vehicles, visitors. If you share your equipment with other goat producers or your trailers, that could potentially bring a disease in. Stray livestock, which is always unfortunate because I know I've had lice 3 times since 2005, since I came to Victoria, and 2 of those instances were from stray livestock being dumped on my place. It could be because of prior land use. There are diseases that can stick around in the soil and on your pasture for quite a length of time. Or yourself. With my own goats at home, I have to make sure that I change my clothes, change my boots before I go and say hello to my own goats when I get home, because during my day-to-day job, there are a lot of diseases I can see. And despite wearing overalls, scrubbing boots in between farms, I still have that biosecurity thing that I do that I don't want to risk my own animals. Now, what are we trying to avoid? We're trying to avoid diseases like Johne's disease, CAE, foot rot, lice, scabby mouth, and this photo here is one of an animal that has got a very bad case of scabby mouth. Noxious weeds, notifiable diseases. The big one that a lot of people don't consider when they buy animals is drench-resistant internal parasites and zoonotic diseases. Because whilst we all love our goats, we also want to protect our families and friends. So it's recommended to quarantine, purchase and returning goats for at least 30 days prior to introducing them to your herd. That's basically so you can get any results for any tests you need. If you need to treat for worms and retest external parasites, trimming their feet, checking for foot rot, allowing weed seeds to come out of the coat or pass through the intestinal tract. And any change in feed can take up to 10 days for the microbes in the rumen to adjust. These signs up in the, I don't know which corner it is. I don't know. Can you, Dominic, can you see my mouse? Or not? No. These do not enter without.
Yeah, I can see it. Yep.
Yeah, these do not enter signs without consent. They are available from the department, and I tend to find if I go to a property for a disease investigation, I ring the number that's written there, because you may have had to go away or had another accident, or the cattle, sheep or goats are out and you don't want someone to come in. It's at least, and the thing is, if they don't ring that and you've got it on your front gate, you can ask them to leave. And they must leave because they've not gained consent from you to enter and remain on there. That's visitors. There are certain organisations, including Agriculture Victoria, that in our instance, for Prevention of Cruelty to the Animal Act, if we assess that there's an issue, we're allowed to enter a property without contacting you first, but invariably we will contact you to advise you of what the outcome is, and we abide by and cover all the biosecurity measures. So I went too far. All right, so when purchasing goats, a vendor declaration is a legal requirement that the vendor must provide. You might also receive this paperwork, which is a National Goat Health Declaration. It's voluntary, but it covers all the aspects of disease risks and animal health husbandry treatments. And if you are going to go and buy goats, I would suggest that you download this and take it with you. They are available on the Farm Biosecurity website in the toolkits section, because this is all information that you would like to know about Johne's disease, foot rot, CAE, lice, and what they were when they were last drenched, what with, any other vaccinations, and any external parasite treatments. Now, not all the diseases are treatable, but reasonable and timely action needs to be taken to identify affected goats and appropriate action taken, whether this be laboratory testing, diagnosis by a veterinarian, treatment, and yes, euthanasia is a form of treatment. If you do need to euthanize, you need to ensure that it is done promptly, safely, and humanely. And from the standards and guidelines, it states a person in charge of a goat suffering from severe distress, disease, or injury that cannot be reasonably treated must ensure the goat is promptly killed. A person must only use the bleeding out by neck cut to kill a conscious goat when there is no firearm, captive bolt, or lethal injection available. So even though it's not a nice thing to think about, it is something that you need to consider when you have livestock. If the unfortunate happened, how would you euthanize the animal? And how then would you dispose of the carcass? A number of goat clubs throughout Victoria have purchased captive bolts, as you don't need to have a firearms license to use or own one. And in rural areas, invariably there are farmers that you could call that do have firearms that could come and you humanely euthanize them if you can't call out your private vet or the knackery or someone else. Now, if you do happen to treat goats with anything, do you need to keep any records? Yes, you do. You need to record what the product trade name is, the species of animal, where the animal is located, any IDs or description of the animals, the dates the animal was treated with the product, and the amount of the product used for each treatment. You also need to record the product's expiry date, batch number, withholding period and export slaughter interval, and the date it's safe to slaughter or consume any milk products. Now, we do have templates for these records available on the AgVic website. You can either use a template or some people just use a farm diary with those notes. If you use a veterinary chemical not registered for goats or a veterinary chemical at a different dose rate to that on the label, you need an off-label advice note from your private vet. The best thing to do is develop a relationship with your private vet so they know you, your setup, and your goats, as unfortunately, invariably, animal health emergencies happen after hours. And if you are regularly using off-label products in your goats, developing an on-farm animal health program that's written down and signed by you and your vet is an ideal situation, because then you've gone through what you might need it. You can just ring the vet and say, look, I've got this. And they can say, look, we agreed to use this dose rate. Now, in Australia, we have substances that are not permitted for use on food producing animals in Australia. The two main ones I see discussed online being used in goats are chloramphenicol, which is in Chlorcig for eye issues, and it's illegal to use on goats, and phenylbutazone, as in bute. Not to be confused with Butec OTM, which is an oral meloxicam paste used off-label on goats for disbudding, castration, and tagging. So whilst these animals are pets, goats are legally classified as food-producing animals, and we have to abide by that legislation to affect our domestic and export trade purposes. Now, some of the diseases next section will cover quite a number of diseases that I get asked about. So Johne's disease is one of the main ones. It's caused by a bacteria that's spread by feces. It can be there because of prior use of the land, purchasing an infected animal, fecal or water runoff from neighbouring or upstream properties, or feed purchased from properties that may have been grazing JD-infected livestock on the pasture prior to the harvest for hay. And that was one difficulty quite a number of years ago with market assurance programs trying to source hay that didn't already have livestock on. So basically, Johne's disease causes thickening of the intestinal lining so that the animal can't absorb its own food, and it starts to utilise its fat and muscle reserves. It's also known as a chronic wasting disease. Goats can lose weight. They may or may not have some diarrhea, and invariably there's reduced production. Goats can get both the sheep and the cattle strains of Johne's disease, and there's no known cure. Guedere, a vaccine, is registered for use in goats that over time with other management practices will reduce the bacterial load on your property. But in the long run, it's better not to have the disease in your livestock as it can cause long-term production and welfare issues. So how can we test for Johne's disease? You can do blood tests. It's recommended at over 12 months of age. There is a price difference between the laboratories. And if you've got a number of goats to test, I would talk to your private vet to try and find one that's most economical for you, especially if you're also testing for another notifiable disease. So with feces, you can do an individual or pooled, and the standard fecal culture, it's up to 25 animals per pool and can take 12 to 24 weeks. Now, the high throughput JD PCR fecal, which you get a result within a week or a fortnight, is not yet approved in goats. There is a laboratory that offers that testing in Victoria, but if the result comes back as negative, we can't say that it is a true negative or a false negative. And likewise, if it's positive, we can't say that it is a true positive or a false positive, because for some reason in goats, it reacts very differently. Or individual necropsy with tissue and fecal culture. Now, what happens if you get a positive JD blood result? What are your options? It is a notifiable disease, but it's deregulated. It has been deregulated for quite a number of years. So the options for you as a producer is you don't have to investigate or find out, is this a true positive or not? But we do recommend that you advise purchasers via health declaration. You can do a full necropsy of the standard collection sites or 2 negative individual standard fecal cultures, 3 to 6 months apart. If you're part of the goat JD map and the suspect blood result is investigated within 1 month, you only need to do 1 standard fecal culture because there are other requirements that producers that are enrolled in the goat JD map do to prevent the spread from coming in. Now, what happens if you do get a standard fecal or necropsy results? Prior to the disease being deregulated, Victoria had 12 herds that we knew that were true positive JD results, had JD animals, and some of those animals were fat as fools. They were happy pushing the bacteria out in the pasture. The producer didn't sell anyone. They were just for their own enjoyment. And that's the thing. You can do nothing, but we do advise if you are selling to other than to slaughter that you advise the purchasers via the health declaration. Other options, if you wanted to test out, depending on the level of infection, we have had herds that test out over a 6-year period using whole herd blood or fecal sampling, or if you wanted to go down that option with Guedere vaccination, testing out by fecal sampling once all of them are approved vaccinates, and that means being vaccinated at under 16 weeks of age. Now, the issue with Guedere vaccinated animals, they may return a positive blood result. Not all the time, but sometimes they do. And if you know someone who's vaccinating with Guedere, that doesn't mean that they have an infection. As producers of clients who want to protect their investment and their animals, or they want to purchase Guedere vaccinated animals due to the disease district risk around them. They might be an area that has a high component of sheep with Johne's disease or dairy cattle. The V in the circle if you are using Guedere vaccination, I would recommend that you order your analyze tags, EID tags with the V in the circle, because then that will indicate to producers who buy your animals not to do the blood test, but to do a fecal test in those animals for Johne's disease. Because I've had instances where clients haven't advised their vet that the animals were Guedere vaccinated and we got a positive result. And we still required to follow up to find out whether they had the disease or not. So CAE, known as caprine arthritis encephalitis. It's a small remnant lentivirus that's spread mainly by colostrum, milk and saliva. It can cause arthritis with lameness and swollen knees, which you can see with those photos of the goats, son and goats there. Mastitis with a hard udder, pneumonia, encephalomyelitis, which is nervous signs in kids, and sometimes adults. So if it is in adults, consider doing a TSE exclusion. And weight loss. The main spread of the virus between goats is through the ingestion of infected milk by kids. Although adult goats can become infected by exposure to infected milk drops during milking. It can also be spread by respiratory secretions, saliva, and tears when goats are kept in close quarters. Can occur with blood on equipment such as vaccination needles, tattooing equipment, dehorners, foot parers, or through exposure to open wounds. Spread in semen and in utero spread to kids is less likely, but can still occur. So basically, any contact with bodily fluids with positive CAE goats, either directly or indirectly, can spread the disease. And as it's a notifiable disease, it means you, your vet, and the laboratory need to notify the department when you suspect or have the disease. And it's advisable if selling goats to other producers that you inform them fully in writing using a National Goat Health Declaration. So for CAE, the testing is usually recommended to be over 6 months of age, and people do it annually. They do it bloods, and as you can see, there is a price range between the laboratories that that are available to Victorians. But in potentially chasing a cheaper price for the lab test, the price might increase for the courier. So it might be best to talk to your vet to find out what is most economical for you. EMAI, Elizabeth MacArthur Agriculture Institute in New South Wales is doing a milk PCR. The virus usually enters a clean property with the introduction of an infected goat. So detecting subclinical infected goats is the key to preventing the CAE spread. And the repeat blood testing during a 12-month period should detect the majority of infected goats. Adult does should not be tested in the period 1 month either side of kidding, as inconsistent results can occur, and shouldn't test within 1 month of any vaccination. With a milk PCR, some producers who regularly milk their goats are conducting bulk milk diagnostic tests once they know they're free, just for monitoring to make sure there's no new introductions, and they will detect it earlier than in the blood. But there's no known cure with the hygienic management and testing and culling of positive goats. The disease can be controlled, managed, and eradicated from a property. The big thing is to consider that whilst the goat may or may not be antibody positive for CA at the time of the blood test, you've got to consider, you've got to do repeat testing for introduced ones because there may be a delay between the exposure and the development of antibodies. And also remember to test wethers and bucks because they tend to get forgotten a lot of the time. So with CAE, you've got welfare issues, pain, weight loss, decreased milk production, and really a reduced quality of life. There's no cure, no vaccine, and no treatment other than pain relief and supportive care. But if they are pets, there are a lot of goats out there that are on regular pain relief and they're living quite a happy life at the moment. If you do happen to get CAE, there is a kid rearing program, snatch rearing program that's available on the Animal Health Australia website that talks about those options. Now, another disease I get asked often is, are my goats lousy? These guys can be very difficult to find. The two lice in the front are your blood-sucking lice. The one at the back is your biting, chewing ones. So we have The pointy-headed blood-sucking lice can cause anemia and ill thrift. The rounded-headed chewing lice causes goats to itch and rub against fences, trees, and other structures. And sometimes, if you have corn goats, sometimes you can tell whether they're lousy by the tips of the undercoat that's on their horns. But it can take time for that to develop. You can tell the difference between them by the head shape, how active they are when they're exposed to sunlight, or if you squish one between your fingernails and get blood, that's invariably the blood-sucking one. So if you've got a dog at all or a cat, flea combs are actually a good tool to see if you can find lice, to comb the goat and see. Now, what product do I use? There's powders, pour-on sprays, there's oral products. Only one product is now registered for use in goats, and that can have health risks for the person applying the product and needs at least 3 treatments 10 days apart. Another product that was registered in goats was diazinon, but as of next week, it will be an offence to possess or use diazinon products in Australia. So I'd really recommend that you check your veterinary chemical cupboard wherever you store things and appropriately dispose of any diazinon via the chem muster groups. So this is a photo of a goat with lice. You might not be able to see that one there, little red dot. And when you look at it, it is actually it can be quite tiny. So for any other products, you should be able to get an off-label permit from your private vet, but you also need to observe the meat, fibre, and milk withholding periods. And also what is called the wool majority of products used for lice in goats are sheep products, and you need to consider the wool rehandling period. This is the period between treatment and when a goat can safely be handled without the need for protective clothing. Because the thing is, a lot of these goats are our pets. We've got young children. You want to make sure if you are treating for lice that your children and your family won't be affected by chemical residues. The other aspect to consider in the choice of product is whether it will have an effect on internal parasites. As with goat lice, for most products, you need to retreat within 10 to 14 days of the first application to kill the nymphs that have hatched from the eggs laid. And you don't want to encourage the development of drench resistance while treating for lice. Oh, wrong way. So I've treated for lice. Why are my goats still lousy? Have you considered co-grazing ruminants, sheep, alpacas, your marimas, your livestock guardian dogs? Whilst goat lice don't breed on other animals, they can be carried by other animals for a certain time period. And usually without, if you've got sheep or alpacas or livestock guardian dogs, they advise to separate them for at least the 2 treatments. So you haven't got the chance of lice that have been in animals that have been laying next to them or in close confinement, reinfecting the animals that you've already treated. Incomplete treatment of all goats. If you are wanting to control lice on your property, you need to treat everyone at the same time. The other issue is to consider the dose rate. Goats don't have lanolin like sheep do, so that a lot of the times one treatment is not enough. And do you need 1, 2, or 3 treatments? You really need to consider the product being used and the contact with those lice and timing of the treatments. Female lice only lay an egg every 3 days. And I see a lot of comments about people, oh, but I treated last year and now I've got lice again. The birds have brought in lice. Bird lice do not breed on goats. And invariably, if 2 treatments weren't done at the correct time, the previous year, it's going to take a full 12 months, up to 12 months for those lice to develop to a stage that it is visible in the animals again, because they are such a slow egg layer. And you mainly tend to see the issues more in winter because they've got a longer coat, which protects those lice from sunlight as well. and potentially chemical resistance. And if you do believe that you've got chemical resistance, there are a number of programs, and the chemical companies are very interested in testing the lice to determine whether it is true chemical resistance or not, because they want to know that their product's working. So what causes diarrhea? Looking at this photo here, we've got lush green grass. It could be nutritional. We've also got marshmallow in that picture. Could be due to them hoeing into that. It could be a bacterial issue, viruses, protozoans like coccidia, or helminths like Trichostrongylus and Telodosargia, which are two types of main worms that goats get. A lot of the time, the diarrhea can be due to worms. Now, I hope all of you have at least visited Worm Boss at some stage. They've got drenched decision guides on there for Victoria and different areas, and also for small landholders. It's a fantastic website and has a lot of really useful information on worms, and goes through step by step through the different aspects of managing, controlling, and treating for worms. Now, there are worm drenches which are registered for goats, for use in goats. And drenches sold over the counter for sheep in Victoria can be used, but only at the stated label dose rates. And because of the way goats metabolize drenches, they need a higher dose rate. And you need a veterinary prescription in using sheep worm drenches at a high dose rate in goats, and to obtain the relevant meat and milk withholding periods. Your private vet can obtain this advice from Parabos, and it explains the differences between what can and cannot be prescribed for goats and the appropriate dose rates and withholding periods. Most states and territories allow vets to repackage small amounts of worm drenches into smaller size containers suitable for smaller landholders, as long as it's repackaged and dispensed with labelled correctly with the client name, the dose rate, and the withholding periods. And your vet can download those labels from APVMA's PubChris database, which is a website which lists all the veterinary chemicals that are registered or that have permits in Australia. So when should I drench my goats? On the screen there is what's called it's normally called a 5-point check, but I like calling it the 6-point check. So you're checking for anemia, which is using the Famacha score. Now you mainly see anemia with Barber's poleworm, but you can also see anemia due to blood-sucking lice. Body weight, and sorry for the Americanisms, but this I could only find an American image. Body condition score, knowing how to assess the body condition score of your animals, and a lot of time you need to put your hands on the animals to actually feel that. Tail, whether they've got fecal soiling, jaw, bottle jaw, swelling underneath the jaw. Now that can also be due to liver fluke. In areas they've got liver fluke. Discharge from the nose, that could be due to lungworms as well, or coughing, and coat conditions. But the big thing is test, don't guess. Because the scouring could be due to something totally different to internal parasites. And then you've just used the labour, the time, and the drench when it wasn't required. Now, what do worm eggs look like? They're two photos of tapeworm and little tapeworm eggs. You need to know whether the goats do or do not have worms. Some producers do their own fecal floats at home, or take fresh feces to their private vet for them to do an in-house fecal float. It's a great monitoring tool, and it can tell you whether you've got low, medium, high number of eggs, but it won't differentiate between the important species, as their eggs look very similar under the microscope. So your Trichostrongylus, Homunculus, and Telodosargia look very similar to each other. What's needed is a larval differential. It tells you the makeup of the worm population in the goats that you've tested. And once you know that, you can start looking at what the best product to use is on your situation and what else you can do on your property to minimize larval contamination of your paddocks and improve the nutrition of your goats. Because unfortunately, the goat industry still continues to rely heavily on anthelmintics for effective internal parasite control. But in the long run, we really need to monitor for worm burdens, test the drenches that we use for efficacy or their effectiveness, and incorporate browse and nutritional supplements. Because no new drenches are going to come out. We need to ensure that we preserve the drench actives that are still providing good control on some properties. So you need to work out what drenches are effective on your property. The more effective a drench is, the fewer drench-resistant worms will remain in the animals after treatment. And if you don't know how effective a drench is, really consider doing a fecal egg count or what's called a drench check after 14 days after drenching. Because if the product you used didn't work, the animals are still going to have internal parasites. So realistically in goats, we should use short-acting treatments and restrict the use of any persistent products for specific purposes or high worm risk times of the year. Because the problem with persistent products is they provide a long period during which larvae can survive and reproduce. Rotating drenches, initially that was thought that would slow drench resistance, but it's only really a small benefit, and only if those animals are rotationally grazed across the property so they are exposed to goats and larvae that have received different drenches. Because when you've got set stocking, drench rotation will not slow the development of drench resistance. It's also important to understand the life cycle of the worms that you're dealing with. What daily temperatures and moisture levels are needed for eggs to hatch. How long those larvae will survive on your pastures with your ambient temperature. Each property is different with the worm population that is in the goats, and resistance to various drench products available is different. As the worms on your place have had exposure to different types and dosage of drenches. I see people say, don't use drench X, it's not worth it. Use drench Y. What about drench Z? It really depends on what is effective on your places. There are some drenches have been around for a long time. Fenbendazole is one of them. It is still effective on some places, and the efficacy of some drenches can be improved if giving a copper oxide wire bolus, particle bolus, at the same time of drenching. Some drenches advise mustering yarding the animals the night before to withhold feed. So there's more chance of that product having contact with the worms rather than being diluted with stomach contents. But that's got to be balanced against the danger of inducing pregnancy toxemia or ketosis. The other thing to consider with drenches is how are you giving the drench? Are you actually using a drench gun that's placing the product over the back of the tongue, or are you stimulating the esophageal groove so it goes down into the abomasum, or are you giving it as a syringe so it's actually swallowed and goes into the rumen and is diluted with all the ruminal contents and has to pass through the reticulum and ulmusum until it gets to the abomasum where most Barber's poleworm is, or the small intestine where the most of Trichostrongylus is. So with Barber's poleworm, you get anemia due to blood loss with lethargy. Goats collapse, they have extremely pale inner eyelids. In more chronic cases, you might see bottle jaw. You can have sudden death with no signs and weight loss. But diarrhea is not a feature of Barber's poleworms unless burdens with other worms are present. The issue with Barber's poleworm is that less larvae are now becoming inhibited in autumn and winter. This is thought to be due to selection pressure from modern drenches, and the parasite has adapted because the drenches do kill inhibited larvae. Eggs have become larger, hatch at lower temperatures, and so their life cycles become shorter. And we're seeing hemonchosis or Barber's poleworm year round in some areas. Now, looking for anemia or bottle jaw, Fermacher is a really good way of assessing the level of anemia in goats, with animals with a score of 1 having a pink, red eye mucous membrane colour and not requiring treatment, whereas goats with a score of 5, as you can see on the photos, have a white mucous membrane and they require immediate treatment and probably intensive and palliative medical treatment. In some instances, blood transfusions would be the only thing that would save goats that have got mucous membranes this white. But with properties whose worm population is developing drench resistance, there are still options available. Biowormer, which is a natural fungus, when it's fed daily to the goats, it passes through the intestine and it germinates the manure. It then traps, paralyzes, and consumes the emerging worm larvae. Whilst it is expensive in a larger herd, some people use it as targeted feeding for pregnant does. And with smaller herds that it's being fed daily with, it's a great tool in breaking the worm parasite's life cycle. Now, hopefully this video will work. This is the fourth compartment of the stomach, which is the abomasum. And hopefully you can see those little white things just squiggling around in that liquid. They're Barber's poleworm. Barber's poleworm is one of the ones that if you do open up the abomasum, you should be able to see. Trichostrongylus and Telodosargia are a bit harder to see because they're as thin as a hair. But these guys are very easy to see. And if you can stop them from coming onto your place by quarantining, drenching, testing, and treating appropriately in the long run, it'll be better for your goats. So why are my goats still wormy? I've drenched. What's gone wrong? They've still got worms. It could be, was your drench gun calibrated? Prior to drenching each time, you really do need to measure and make sure it's drawing up the product appropriately. Flush it through with water and measure it to make sure it's giving the correct dose. Weighing of goats. I know when I have weighed goats for people, I get them to estimate the goats, how much they weigh before putting them on scales, and invariably it's an under guess. They're 10 to 15 kilos too light. If you haven't got scales or can't borrow scales from a friend or your local stock agent, there is a calculation using a measuring tape at the heart girth chart, and that is pretty accurate. Incorrect dose given. Unfortunately, there are producers out there who still believe that the dose on the label is the correct dose for goats. Please talk to your vet, and if your vet doesn't have the correct information, you can get your vet to give me a call. Because goats metabolize drenches a lot quicker than sheep. Now, if you're using products with more than one active, there are products out there that with 2 actives, 3 actives, 4 actives. You need to ensure that the product is mixed properly and regularly whilst you're using it, because the product will sediment out. How are you storing your product? A lot of the chemicals have got stored below 30 degrees. Up in my area, I only buy drench when I do need it, and I store it inside my house, because invariably I get up to 40 degrees temperatures up my way. If I stored it in my shed, it would be affected. Re-exposure. Some people don't understand how long paddocks need to be spelled to ensure that goats aren't re-exposed to larvae on the pasture when they're doing paddock rotations or spelling. And drench resistance. Other issues I get asked about are eye conditions. The big thing with goats with eyes is that excessive weeping or oozing can be indications of pain. It's very painful, and goats are more prone to other injuries if they cannot see what they're doing. So eye diseases with or without blindness can be caused by foreign bodies, as in grass seeds behind the third eyelid, and this causes tearing and ulceration. You can get corneal trauma from horns and sticks, conjunctivitis, entropion, which is where the eyelids roll in and scratch the actual eyeball, and that's normally can be seen in young kids, and it may or may not have a heritable factor. Lead poisoning, listeriosis, polioencephalomalacia, and pink eye. Diagnosis of the cause is important to enable prompt pain relief and healing. There are eye creams and sprays that can be effective, but with using the sprays, you need to consider how much is actually contacting the eye, and is the goat actually blinking due to the hiss of the can, and it's just making skin around the eye look like it's been treated. Another thing that occasionally happens is goiter. Now, this picture here is goiter from iodine deficiency, which is an enlargement of the thyroids. In healthy, well-fed kids, you can get called what is called milk goiter, which is an enlargement of the thymus. Goats are more susceptible than sheep to iodine deficiency. And as a general recommendation, all breeding goats in low iodine areas in Victoria should be provided with supplemental iodine. Some producers do it as a strategic potassium iodide drench, or they use iodine salt licks to prevent goiter and heavy mortalities in newborn kids. Because with newborn kids, you can have them born with these enlarged goiters, or what it also does is lower the number of hair follicles in the goat, so they can succumb to cold chill and everything when they're born. Other conditions I get called about are abortions. Now in does, pregnancy is maintained by the corpus luteum. Anything that can cause this to rupture can cause the goat to abort. Nutritional stress, feed stress, environmental stress, a new dog, transportation. Some drench actives, depending on what time of the pregnancy, can cause abortion. Trauma, bacterial protozoan diseases. The big thing to remember is zoonotic aspect when handling aborted products. If you're going to get these diagnosed, glove up, double bag the fetuses and part of the placenta, because with the fetuses, the laboratory can potentially diagnose certain diseases, but the placenta is also important. But the thing is to consider your health as well. I also get asked, do goats need to be vaccinated? It really depends on the disease and what the welfare implications are. What is the likelihood of the disease occurring on your place, the cost of the vaccine, and the efficacy. For tetanus, enterotoxemia, and cases lymphadenitis, which is also called cheesy gland, it is recommended to vaccinate 6 monthly if you do choose to vaccinate. With people who've got small numbers of goats, I usually recommend approaching their vet to see if they can dispense it. I know when I was in private practice, I used to have vaccine months to use up the vaccine within the 30 days, and I would contact all my small producers and we'd get them into a routine and provide the vaccine to them.
Excuse me, Berwyn. I think your microphone might be, it's just cutting in
Okay.
and out a little bit.
Sorry, is that better?
I think so.
Thank you. Sorry. How much did you miss?
Oh, it's just the last 30 seconds or so.
Okay. With vaccines, get in touch with other local producers. I know locally, I've just had my alarm go off in the building potentially. Vaccines are not 100% protective, and even with vaccination, some animals may succumb to the disease. Where there's any risk of disease and a vaccine is available, that it is a cheap and almost also always worthwhile investment to prevent or minimize the disease condition. Now, this slide is to do with, it's taken from the sheep. So that's why they've got an annual booster, but we recommend 6 monthly in goats. And this is normally how to do it if the goats are vaccinated in the 4 to 6 weeks prior to kidding. So normally the kids are born, they get maternal antibodies from the colostrum. You give the first dose of the vaccine, and what this does is prime the immune system, but it only provides a small amount of short-term protection. It's the second dose of the vaccine that the immune system is capable of providing protection against the disease longer term. And a 6 monthly booster dose is required to ensure the goat remains protected until its next booster. We have some properties with high producing goats and high challenge, dairy goats mainly, that are finding they need to vaccinate quarterly or every 3 months to protect against enterotoxemia. Now with vaccines, really read the label. They are sensitive to temperature and light. Freezing, overheating, or prolonged exposure to sunlight will kill vaccines. The length of time a vaccine can be stored for depends on the sterility of taking the vaccine out to reduce the subsequent growth of organisms and whether the vaccine has a product in it to stop other bacterial growth. There are vaccines out there that you need to use within 12 hours of opening. There are ones that you can use within 30 days. There are others off-label for goats that you can use within 50 days. You really need to read the label and the insert thoroughly before any use and follow all directions or restrictions, including dose rates, how you administer, whether it's subcutaneous and where the recommended site is, any PPE you need to wear, and disposal of the empty containers and unused product. When you actually go to buy your vaccines, make sure you take an ice brick and a freezer bag with you. Consider the ambient temperatures when you are actually vaccinating your goats. Should you have an esky with an ice brick so you can put your vaccine gun and your vaccine in there whilst you're organising your animals? And get into the habit of writing the date that you opened the vial on the pack, especially if it's a vaccine that has to be used up within 30 days of opening, because sometimes people forget, did we do it a fortnight ago, 3 weeks? And then when they actually look at, if they do record their activities, when they actually look at it, they find out that it's been longer than 30 days. And also consider whether any animals are receiving antibiotic treatments at the time or shortly after, because the vaccine response may not respond adequately. You may get swelling at the injection site. Some vaccines cause animals to have an increase in temperature. Some vaccines, because of the adjuvant used, cause a sterile abscess. So ensure where you choose, you are consistent with it. So you can, if you do get any unusual lumps and bumps on your goats, you've got a more chance of knowing that that was because of a vaccine. The main issue with goats' feet can be foot rot, scald, overgrown hooves, uneven growth, and wear due to poor foot conformation. It really depends on your land terrain, whether your goats have rocks to climb on or abrasive surfaces to walk on. Otherwise, you may find that you are regularly trimming your goat's hooves. There are plenty of videos online on how to trim a goat hooves, and the best way to learn is to actually go and help and see another experienced breeder trim their goat's hooves. You need to learn how to restrain the goat comfortably so it's not stressed or fighting you. You need to find a pair of foot pairers or secateurs which are easy for you to use and keep them sharp, clean, and disinfect them between properties or mobs. A hoof pick is fantastic for getting in and cleaning the hooves and removing any hard dirt or stones prior to pairing, rather than using the tips of your cutters, which can, if the goat jumps, you can inadvertently puncture the sole. The goal of trimming the hoof should be to get the bottom of the foot to match the angle of the coronary band, which is where the hair ends at the top of the foot. If you only have a few goats, yes, you can do them standing. They don't really like being placed on their rump as you do with sheep. But if you have a lot, consider either making a raised stand to restrain them or buying a tilting cradle, that it'll be a lot nicer on your back in the long run. Any condition that is affecting a goat's normal movement really indicates that animal is in pain from feet. Some people don't consider how much long toes and the issue of stones getting caught in those toes can actually affect an animal's gait, cause pain, how they actually graze and get food. Goats are a prey animal, and they try to hide or mask issues and exhibit few obvious signs of pain or distress. If you do have scald or foot rot and you're foot bathing with 10% zinc sulfate solution, I would recommend using zinc sulfate rather than copper sulfate, because if the goats inadvertently drink the copper sulfate, you will end up with copper toxicity. Ensure that the hooves are cleaned and trimmed first, because you want that product to penetrate properly. Use the timer on your mobile phone for 10 minutes, because a lot of people, when you tell them to judge 10 minutes contact time, is normally only 5. And have an area after that foot bath the goats can stand in, and the hooves dry out before moving to a new paddock if you're moving them to a new paddock. And for foot rot control spelling of paddocks, they recommend 14 days, because that will also counter for anything that's in the shade or inclement weather. Now, which way? So if you're losing goats, what should you do? You might have a neighbour who's got goats, a mentor. You might have a vet. You can ring the department, but please don't ignore it. If your goats are suffering unusual signs or significant deaths, animal health staff can investigate it, or we can approve your private vet to undertake a significant disease investigation with subsidised lab testing to determine what is happening on your property. It's better to find out why your goats are ill or dying and whether it's something that can be easily treated or prevented. So the main thing is to consider is really look at what comes onto your property and consider what leaves your property. Because if you've got a disease on your place, you want to control it, and you don't really want to spread it. Good management, good husbandry is essential in protecting your own stock, and everyone's got a role to play. No matter how many goats you've got, whether they're dairy, fibre, or meat, whether it's 1, hopefully it's 2, or whether it's 1,000. Each person has a bit to play in the health and welfare of our animals. Hang on, that last one didn't go. Where have we gone?
Thank you, Berwyn.
Thank you for listening.
If,
That was meant to be the last slide and it disappeared on me.
if you could, yeah, if you could keep those slides up just in case we want to refer back to any, that'd be great.
Sorry.
Terrific presentation. Lots of great tips in there, some biosecurity stuff, lots about symptoms to look out for, preventative measures. Yeah, all terrific stuff. So now's a great time if you have any questions to pop them in the chat. There's already some good ones coming through. Berwyn, I've got one for you. Is there a map someone can look at in Victoria? Is there a diseases pretty evenly spread, or are there some areas of Victoria where there's a certain disease is more common?
There are areas of Victoria that are more prone to mineral deficiencies depending on the soil, such as copper or iodine. And usually producers either do soil tests or they supplement. The issue with copper deficiency, there are areas that are copper deficient, but there's a fine line between copper deficiency and copper toxicity. So it's best to actually find out what is on your property and consider what you are supplementing. Other diseases which there can be deficiencies is selenium. Selenium is connected with what's called white muscle disease, selenium and vitamin E. The issue with selenium is that there are a lot of products now available that have got selenium. So if you are supplementing with selenium, consider what selenium is in your mineral loose lick or block drenches that you use with selenium, or vaccines that have got selenium in there, because there have been cases of selenium toxicity because people used vaccine drench and mineral supplementation that had it because they thought more is better, but it's not always the way.
Yep, thank you. And there's a question here, how do I find out if my area is a liver fluke area?
I think Worm Boss might have maps on it, but normally I'm in northern Victoria, and in dare I say 20 years, I've only seen liver fluke twice in sheep up here. Liver fluke tend to be more in areas where you've got the snail, Limnaea tomentosa, which can spread it, and when you've got water lying in areas that enable the snail to occur.
Yeah,
Your fecal egg counts, you can ask for your fecal egg count to test also for liver fluke eggs as well.
thank you.
And fecal egg counts, when you're asking for a lungworm test, it's a different test. Sorry, I should have mentioned that with the lungworm. It's called a Berwyn test. It's a different test to use.
If you've just bought some new goats and you're quarantining and you've requested an animal health declaration and there hasn't been anything listed on there, it's of concern. Would you still recommend testing for worms and
Yes,
for
yes,
Yonis and for CAE?
yes, yes. I know when I purchased my first goats in Victoria, this was prior to the animal health declaration and prior to analyze being introduced, and I individually tagged all the goats with a numbered tag and asked the owner when they were pregnant, when they were due to kid, all that sort of stuff. I'd ordered my vaccine. Unfortunately, the proposed kidding dates were they started kidding in a week's time rather than 4 weeks' time. So I did end up losing a couple of kids that year due to enterotoxemia because the former owner didn't vaccinate them. But you want to make sure that you're not bringing in disease with any animal. So fecal egg counts are great. And even if it confirms that it's negative, you know that you didn't bring um, drench resistant worms in with that animal.
Thank you. There was a comment here, 12 herds positive to JD before the deregulation. What is the incidence now? Do you know that?
It's not reportable nationally. I could say 12 before. We're probably around the same level. It might be up to 14 or 15. I would have to check, but it's not published data. That 12 was the what was published in Animal Health Australian reports.
You
But
mentioned,
but
see,
but the disease of Johne's disease in goats is a lot less than what it is in sheep and dairy cattle in Victoria, and
yeah,
that's mainly because a lot of producers in Victoria actually test. They test to make sure they don't have the disease because they don't want the disease to affect their enjoyment of the goats.
yep, that makes sense. You did mention CAE. Is it more common in dairy goats? And if you do give pain relief, if you do give pain relief, if a goat does have CAE, is there a chance of that disease spreading further?
Because they're pets on farm and being given pain relief, they're normally aged pets that are not going to leave the property and they die on farm with those. And that's normally for people who buy and sell. If they've got CAE diagnosed, they don't normally sell to other producers. The reason why it is mainly in dairy goats, but there have been instances of bull goats getting it, having been fed dairy goat milk. And it tends to, more than likely, tends to be in intensive commercial operations because they've sourced goats from a wide range of source to get their numbers initially. But a lot of the commercial intensive goat dairies are doing regular monthly testing because they want to get rid of the disease. They're doing blood tests and milk tests because they can see how much this disease is reducing the productivity of the goats and the actual milk production. So whilst people point their finger, oh, it's all only in the commercial dairy industry area, those guys are actually trying to do something about the disease.
Great. And just to clarify, pain relief doesn't stop the spread.
No, pain relief doesn't stop the spread. It allows the animal to have a better quality of life if there is arthritis. And it's really you've really got to assess the quality of life of an animal whenever you give pain relief when they've got a disease that can affect them. And those guys that have got these animals have got a good understanding with their vet that once it gets to a stage that the animal is no longer comfortable or happy, the vet's going to go out and euthanize them for them.
Thank you. There was a chemical you mentioned that's being,
Diazinon.
how do you spell that?
Diazinon.
Okay, thank you. And what's the reason that's being
Oh,
banned?
huge risk for human health. Huge
Yep.
risk for human health. It was, and it was only recently, yeah, there were a lot of reasons for it to be done, but the main one is human health issues.
Thank you. Is there a goat drench that's okay to use specifically for Barber's pole on a pregnant goat? If, yeah, it's been confirmed. You did mention biowormer.
Yep. It just depends on the stage of pregnancy. Of course, there's issues with albendazole, albendazole, I think it is, and levamisole. With some, it's the first trimester. With some it's the last trimester. It really depends on what it is, and it depends on what's effective on your place. The other thing consider is with very heavily pregnant goats, you don't want them to have a worm issue. You want to have controlled that worm issue prior to them actually getting pregnant, because you want all that nutrition that they're eating to go into the development of the kid and the fetus, because there's nothing worse than having little kids being born that are weak with anemia and die, and then the mother dies as well.
Question here, which drenches have been associated with abortions?
It's an actual active of the drench. So there are drenches out, like Q drench has been associated with abortions at particular time of the pregnancy because it has one of the actives which can cause abortion.
Thank you. If you do a follow-up fecal egg count and still have worms, is it okay to worm again? Or what is the time frame to worm again? Assume using a different drench.
Yeah, it is. Some products have a do not reuse within a certain time period, but that is not preventing you from using another product that's not involved with that drench. And that's the big thing, understanding what actives are in the drenches that you actually use. Because you might go to the your rural reseller and buy drench A, which is a couple of actives, and then go, oh, I've got to use a different one and use drench B, not realizing that some of those actives are the same in both drenches.
Thank you. Is pestine powder still okay to use on goats for lice?
It is. You just have to do it in a well-ventilated area, wear gloves, and it is usually recommended because it's a contact. It's sulfur and rotenone. The actual lice have to come in contact with it. I would only recommend it for a couple of goats, not a lot, because the packages aren't that big, and it's 3 treatments 10 days apart. So it's really important to write it down and everything else and be very careful that you don't breathe it in yourself.
Great to know. I should mention I did say biowormer was a drench. It's not a drench.
No, it's
Yeah.
a fungus that gets eaten.
Thanks for that comment.
And you can get the biowormer either through your private vet, either a straight biowormer, or you can buy it from the rural livestock reseller with livermol.
What would you suggest in place of pesticine?
There are sheep products which your private vet can give you an off-label permit for. I
Thank you.
know.
What are your thoughts on using copper sulfate if you have trough water, Berwyn?
I prefer the copper to be in a loose lick rather than in the trough water, because the trough water can get diluted, be affected by the weather. At least with a loose lick, they can take a mouthful and move on. You don't really want anything in the water that will stop someone from drinking it. If you do provide copper sulfate in water, I would definitely have another free water source, because being able to have clean potable water is important for the prevention of a whole lot of diseases, especially urinary calculi and wethers and bugs.
Thank you. I think you might have covered this. Can you name products for both lice and ticks?
Oh, okay. Ticks, I can mention that Amatraz is registered in some states for ticks, and Pestine is registered for lice in goats. The off-label products, unfortunately, I cannot name, but your private vet should be able to prescribe them, because anybody could be watching this webinar and I don't have, whilst I'd love to have a vet client patient relationship with everybody who has goats, I don't.
Is biowormer with liver mole as effective as straight biowormer?
Yes, it is, but if you get the straight biowormer, you need a lot less.
Thank you.
So in the long run, it can be more economical to buy the biowormer, straight biowormer.
And another question here about pregnant goats in their last trimester. What's a drench you'd recommend?
It really depends on what worms are involved and what previous drenches have been used on your property. Every situation is different and it's an individual situation. So if people do have an issue, they can contact me and I can talk through their own individual situation.
Thanks, Berwyn. You did mention in the presentation about reading the label for vaccines. Is a day or two either side of a 30-day vaccine? If so, it gets to 31, 32 days after opening, what are your thoughts on that?
I can only recommend the 30-day There are some vaccines which are disposed of within 12 hours. There are some 24, some are 30 days, some are 50 days. I can only recommend what the manufacturer has done.
Yep, that makes sense. With the 50 days, do you know off the
That
top of your
that
head?
that's a product that's off-label in goats, so you'd have to get a permit from your private vet.
Talk to a vet about that.
Yeah. But if you are interested in any of the vaccines and what the withhold, the labels actually say PubCris is a really good database to look at.
What was the name of that?
PubCris, PUBCRIS.
Thank you. I might list that one in an email. Does biowormer work with sheep as well?
Yes. And I know overseas it's marketed heavily towards equine producers.
Great, thank you.
Dr. Sandra Baxendale has a lot of information on her webpage on biowormer, and she has got the results of clients of hers that have used biowormer. One thing to be mindful of bioworm, over time it will change your worm profile.
That's great to know. With H1N1 due this season, almost certain this year, are goats in the susceptible mammals class?
I really hope we don't get hate.
Is
I
that
really hope.
just for clarity,
Avian,
H1N1?
avian influenza that is currently Australia and New Zealand are the only diseases, only countries that don't have this this strain of avian influenza at the moment. Initially, they thought we were going to get it from the north, but now they're talking potentially we may get it from the south because it's down in Antarctica at the moment. In America, there have been instances of goats getting it. There are a lot of reports of dairy cattle getting it and affecting milk production. Who can say what will happen? I just hope we don't get it because it will devastate our native wildlife and birds population and anything that eats birds, as in your quolls and Tasmanian devils and things like that.
Thanks for that detailed answer. Something to think about. Is there anything that can be done to prevent kids developing aspirated pneumonia soon after birth?
Other than monitoring them with their temperature and clearing the nose out once they're born and stimulating them to sneeze so they can sneeze out that fluid that is around the nose and everything else like that. It used to be the case that you'd hold the kid up and let the fluid drain out. What they've found is that fluid is from the actual stomach. It's not the fluid that's been aspirated into the lungs, and it's better to stimulate the kid to actually sneeze and try and sneeze it out. I've been kidding for the last 20 years and I've not yet had a case of aspiration pneumonia, and I've delivered kids which have been breech, backward, tooth coming out at once and all that sort of stuff. I'm not sure whether the person who's asked the question, is it that they're not intervening soon enough in looking at the 30-minute procedure and not intervening soon enough or clearing those fluids around from the mouth?
That might be something worth thinking about. Got one more. Is soybean meal the best protein meal to use, and is it available? If it is available, is it okay to production feed with it?
That would have been a question for Jess last week. I'm not a nutritionist. I would have to go and have a look at Feederpedia with what they say about soybean meal and how much can be fed. But if you are interested in alternate feed products, Feederpedia is a really good website to look at.
Well, it's impressive all the disease-related questions you're able to answer, Berwyn. So thanks for that. I think we'll wrap it up there. Just a reminder, this recording and the slides will be emailed out to you probably tomorrow. And I encourage you to check out our other videos on YouTube. You can search VFF Stock Sense and you'll see those ones. And if there will be a feedback form emailed out as well. So if you'd like a different topic discussed, please just mention that on the form. Thanks again, Berwyn. Always very lucky to have you here, sharing your passion and your knowledge with us on goats. So thanks for that. And
thank you very much for being given the opportunity.
And yeah, I guess that concludes the webinar, and we hope to see you at a future one. Thanks very much. Good night.